you. You're holding your secrets for way too long. This can't keep going on. With every lie, they keep on hurting you, getting away with everything they do. This can't keep going on. No, we're gonna find them, and I'm gonna fight for you. They better start hiding. We'll be running with the lions, lions. We'll be running with the lions, lions. They can't run, they can't hide. We won't stop until they're down. We'll be running with the lions, lions.
Hello, everyone, and happy Sunday. And I'm your host, Dr. Kalpana Sandar on Gloves Off. And today I'm super excited. We have a beautiful guest. Her name is Anna Ginsberg. But before we get into all that, I really want to thank all of you for watching the show and tuning in every week. And for those of you who are new, I just want to give you a little bit of information about this show. So Gloves Off was an idea that came to me because I really wanted to showcase people who really live their life to the fullest and show up courageously, strip themselves of their ego, their quote unquote gloves, and do what they really love in the world. And you know what? When you do what you love in the world and when you're serving humanity in the way that feels very authentic to you, it shows, because you know what? You don't show up miserable. You're not impatient. You're not angry. And I'd like to personally see more and more of that in the world that we live in today. So for those of you who are new, welcome. And if you like the content that you're seeing, please like, share, comment. You can follow me on @GlovesOffTV on YouTube, Instagram, and Facebook. We're pretty much everywhere. So would love to, have you invite your friends and everything. But before we get started today, I'm going to just tell you a little bit about my platinum sponsor, Elevated CPA. And tax season, April 15th is over, thank God. But we're already probably wondering about next year's taxes. And some of us don't know when it's time to get an accountant involved. And honestly, if you watch the interview with Doug Benefield a couple of weeks ago, you can find it on my YouTube channel. The best time is when you have another side gig or any kind of small business, which is probably something people don't know. So again, before it gets too late, if you're looking for an accountant, never a bad time to start now. All right. Well, one of the things that you guys probably don't know about me is the fact that I was in the aesthetics industry. I had an ear, nose, and throat practice and a medical spa for about 20 years. And when I was doing aesthetic procedures, I really enjoyed working with my patients and with other aesthetic providers. And now I actually still work with a lot of aesthetic providers, and I really enjoy it because I feel like we have a similar history, and the aesthetic providers that I currently work with, we all have a similar approach, because I think there are a lot of misconceptions surrounding the beauty industry. People think that, people who get aesthetic procedures are vain or conceited or afraid to age gracefully, and or that many people look weird. So the thing is that a lot of those misconceptions are not really even true. And, I know why they come about because we've seen those things in Hollywood and some of the old procedures that were done and overdone. But, the aesthetics industry has evolved over the years. There was a period where people were just learning how to do things. Then I feel like there was a period where people were doing way too much, but I think it's fallen back to where most providers, not all, unfortunately, are really looking to enhance the patient's natural beauty. So that's a little bit of what we're going to deep dive into today. And Anna Ginsberg is a registered nurse, and she's worked in the medical field for many, many years, but recently she's taken a leap into entrepreneurship. So we're going to deep dive into a couple of these topics with her. So Anna, welcome to Gloves Off.
Thank you.
So nice to have you here. And I'm so excited to get into this conversation because most of our viewers are women. And I know that many people just have questions and concerns. They hear things. So, as I was saying in my intro before you came on, there are so many myths, right, in the aesthetic world about procedures. So what are the common things that you see when patients come in, like maybe a first-time patient, and they're afraid to have a procedure done? What are their concerns?
Most people are afraid of not looking like themselves anymore. They're afraid of the treatments being noticeable. So I think that's a lot of what I do is counsel people that we're not trying to change the way that they look. I'm trying to stop aging from changing the way people look and try to get you back to more of a baseline where you started when you were youthful.
Yeah, that's perfect. And that's really where I feel most people probably want that. For example, I used to get these patients that came in and say, show me a picture of somebody that looks nothing like them and say, I want to look like this. I mean, that to me was like red flag, red flag, red flag. And I would say, well, I'm really sorry, but I don't want that for you, and you shouldn't want that for you. And, maybe you should find somebody else that will do that if you can find somebody. And I would just turn those patients away. Are you finding you're even getting patients like that often, or not really?
Not so much anymore. I mean, one of our biggest jobs as injectors is saying no to people when procedures are not right, or we just don't think that their expectations might not be able to be managed. But not so much anymore. My practice is, I go for a natural aesthetic. As you can see from my face, I'm all about a natural aesthetic. So I tell people, look at your injector's face. If their goals, if they look natural to you, if their goals emulate your goals, that's the person for you. But I don't think I think people are just more afraid of looking unnatural.
100%. And it's a natural concern, and it should be a concern because I feel like my ideal client was always the person who wanted to look like a better version of themselves. Mm-hmm. So when you're saying aging, aging starts a lot earlier than I think people think. So let's talk a little bit about that. What do we start to see as early as our 30s?
Lots of collagen is gone. Collagen just gets depleted. Bone resorbs. Fat pads are minimized and they also descend. So we age from top to bottom and medial to lateral. So that kind of our temporal area starts to hollow out sooner than other things. And most patients don't even ever notice their temporal area, which is a huge, huge area that we can rejuvenate. It's going to lift the eyes. It's going to help with the mid-face support. So yeah, just a lot of kind of everything. It's multimodal. It's not just one thing with aging.
And it's so important. I love that you brought up temples. So, full disclosure, I had Anna inject my temples a couple of weeks ago, and it's a huge difference what I know. Yeah. It's funny because, I'm definitely older and I've never had my temples injected. Yeah. I knew I probably could have used it a while back, but it just wasn't bothering me. And then all of a sudden I was like, oh God, this needs to happen.
And that's funny because after you came in, I started noticing my temples even more. So I got a little filler in my temples a couple ago.
It's so funny. We're our worst critics. Yeah. That actually brings up a really good topic that, I'm going to go a little bit on a tangent. We're going to come back to what we were talking about because I don't think it's really off on a tangent. When you were saying about looking at your injector and determining, what they look like and if that's in alignment with what you see for yourself, I think it can be a very slippery slope as an injector to almost be overly critical of yourself.
Mm-hmm.
So I say this because I have seen some injectors that I would not say were aligned with my vision of natural beauty, but they actually were really great with injecting other people to a very natural state. So that's a little complex of a conversation, but I think as an injector, you tend to see so many things in yourself. And I think there's a lot of discernment that you have to learn over time to not address something, even though you can.
Oh, yeah. We can get crazy. We have everything at our disposal here. So you can get crazy, but I'm so conservative. Like my other injector friends laugh at me so much. I mean, I got filler for the first time maybe a year ago. I'm very conservative. So I think I'm on the other end of the spectrum there.
I think you and I are very, very much alike. I
Yes.
was the same way. I mean, I was very conservative. I'm still very, very conservative. Have I had things done? Yes. But the amount of things I get done compared to what everybody else gets done is little to none.
Yeah.
And I just don't want to look weird. I don't mind looking older. Like that's not my fear. My fear is to look not like myself, to have my face look unusual in the mirror or to look done in any way, shape, or form. So
Sure.
that's where I'm at. And so I love that you're the same way. So again, I think it's really important, right, to talk to your injector, see what their aesthetic goals are, probably for themselves and for you, and make some decisions from there. Now, what other things should people be looking for in their injectors?
Oh, it's all over it's funny, like this industry is old, but it's new. It's a very new industry, and there's a lot of gray area, and there's a lot of different people that are getting their hands into it. So it's super important to make sure that your injector, if it's a nurse, that they have a supervising physician. And is that supervising physician in the world of aesthetics, or is this an orthopedic surgeon? So make sure that there's a collaborative relationship there. Make sure that this person is doing continuing education. Look at their Instagram. Do they have a website? If they don't have a website, they don't have Google reviews, that's a red flag. So just people that are out there in the community that have a good reputation, and look at some before and afters, definitely.
I think in the past, when the aesthetics industry was just kind of getting going, I remember people used to really go by the building and these amazing like Taj Mahal type spas, that was all the rage probably. Oh, now I'm going to date myself. I think probably in the, probably 2005-ish, 2010, something like that. Whereas this stuff was just really starting to get popular and gain some traction. So I remember people would base everything on that. And I would say, because my med spa was within my ENT practice. So although it was nice, it wasn't a Taj Mahal type of building. And I used to always express to people, that really doesn't matter. It's what matters is the skill of the injector, whether people are getting the desired outcomes that they want, whether they're getting complications. Those are the most important things. So I still feel that holds true because there are some there are some spaces that are really luxurious and, and I'm not judging if that's what somebody wants, fine, but also make sure that the person who is injecting you is going to take the time, take the time to know you and understand you and give you that boutique feeling. I'd rather have a boutique feeling than a luxurious setting.
More people are saying that. I just had a patient come in yesterday that she said, it was a new patient. And she said, I was looking, I found, there's a big med spa by my house, but I don't want to go to a big med spa. I want a small boutique experience. So now it's shifting to more of what I offer in a small studio setting. So it's interesting.
Well, because it's really comfortable and you don't have to be in the waiting room with anybody. You just go in and you see your injector, you talk and you get things done. And it's just important, right? The relationship, I think, is the most important thing. Somebody who listens to you and understands and acknowledges what you're trying to go for.
Sure. Trust is huge.
Yeah. And it was funny because I know even when I had come in, you're like, well, what would you do? It's got to be nerve-wracking when you're injecting another injector.
Yes. Oh, it is. Our friend popped down from Carlsbad. It's like, ooh, all right, I'll do your lips, but I hope you love them. Oops.
Yes, that's so funny. But Well, the other things that are really interesting to me too is that when does so how did you make the shift? Because you were a surgical nurse for many years, right?
I
So,
did. I've been a nurse for 20 years this month, which is crazy to
wow.
me. So when I graduated, University of Michigan, I went to Chicago and I did labor and delivery for a few years. Then moved out to San Diego and I was a surgical nurse for 15 years. But I never wanted to be full time. I was always a part time hospital nurse and I didn't want to be full time. So I started my own
Why didn't
kind
you want to be full
of
time?
side hustle. What's that?
Oh, why didn't you want to be full time? Because you wanted a side hustle?
Heavy burnout. I couldn't do it. It was too much. It's too
Right.
much. I loved it, but I loved it part time. Full time,
Mhm.
you get sucked into the politics, and it's crazy. You're exhausted.
Mhm.
And I was just yearning for something new and different, more of like in a provider role. So there was a nurse I worked with. She was an injector and also a surgical nurse, and she had this side business. So I started 9 years ago partnering with ENTs or plastic surgeons, whomever I had a great relationship with in the OR, to be my supervising physician. And I used their offices, but always retained my own patients, had my own business. I scheduled them and used the office space and had a supervising physician. So that's
That's
what I
a
did for a
great way
long
to
time.
do it. That's awesome. I didn't even know this about you. So
Yeah,
what year was this? How long ago was this that you
that
started
was
the
2015.
Okay, okay.
Yeah.
Do you have that entrepreneurial bug even back then?
Yes, I know. I always kind of have. Yeah.
That's great. That's great.
Yeah.
So what did you know that you'd be out on your own doing aesthetics back then, or was it some
No, it just kind of morphed that way. There came a point where I started liking my new career better than the hospital. And I just felt I was stimulated by it and it's new and there's so much to learn all the time. The continuing education with this is paramount because you don't have to get continuing education. The real top.
Oh, I think we lost Anna. Hopefully we'll get her back. I love when technical difficulties occur. Probably a Wi-Fi issue, right? Sometimes. Oh, there you are.
Sorry.
I was like, probably a Wi-Fi issue or something,
Yeah.
but whatever.
Somebody called and I guess it kicked me out.
Oh, gotcha,
Sorry.
gotcha. No
Sorry.
problem.
Trying to not disturb this thing. Okay.
Yeah, so we were saying that basically, there's so much education in the aesthetics industry.
Yes, and either you're doing it or you're not doing it because it's not required. So
Hmm.
those top tier injectors are getting a lot of education and it's fun. It's super fun to learn all this. I mean, you learn I think I know everything. Actually, I don't, but I think I know a lot. Oh, what do I need to go to this little filler training session for? It's amazing how much we learn. So it's important to to take advantage of those opportunities. And that's what makes you being the best injector. So I loved doing that and learning and just kind of was a little burned out from the OR. Felt like I could do it in my sleep at a certain point.
And it's funny. It's funny that you say that because I have had a similar, obviously, experience with
Yeah,
that. People say, you left surgery? Why would you leave surgery? And I'm like, to be honest with you, it got kind of boring in a little way. So
right.
here's what I tell people about that. Like I hear what you're saying about like part-time. I luckily had a busy office practice, so I wasn't in the operating room or in the hospital like all the time, which was really good. And so it took
Yes.
me out of the politics and all that stuff that I didn't want to be a part of. And then eventually I just stopped taking call and I stopped working at the hospital altogether because I hated the politics. And I also really am very efficient. So I love
Yeah.
efficiency. In my office, I could just, have lots of efficiency. My staff was a well-oiled machine and I loved
Right.
efficiency. The minute you go to the hospital, there's nothing. Efficiency is like, what is that? That
I
drove me
know.
crazy. So I
Yes.
started to just do more surgeries in the ambulatory surgery centers because they were very efficient. And luckily, as an ENT surgeon, most of our cases can be done in an ambulatory care setting. And I was doing mostly sinus and larynx stuff at that point, so
Yeah.
it worked out really well for me. But going back to the operating room, I literally got to the point where unless there was some sort of drama going on, it was a little boring. And then when there's drama going on, it's like life or death drama, which is not really what you want because it's fight or flight. So I was like, well, I want the excitement without the crazy.
Yeah.
So how do I do that?
Exactly. Something new and different. That's how you do it.
Right. And for me, one of the other things I realized is, number one, I didn't like being stuck in one spot all the time, day after day. I like the idea of being in different spaces or doing a lot of different things because I have so many things in my wheelhouse after all these years of doing, so many different things with entrepreneurship and speaking and television and all those things that, it was more exciting to me to do a bunch of different things than just one thing all the time. But, it's nice to hear somebody else say that the surgeries kind of got a little,
Oh, and I was an ambulatory surgery nurse for 10 years. Like I did a lot of ENT, a lot of ortho, plastics, and I was so efficient. I always had the quickest turnovers of anyone. So then I did that for 10 years. And then I went to Scripps Encinitas and their main OR, and it's a main OR. And those turnovers are molasses. And it was just, I couldn't handle it. I was jumping out of my skin.
Me too. That was the worst. I mean, I used to only go to the hospital when I was doing like thyroids and those kind of things, those bigger cases. But, honestly, it got to the point where I'm like, it's not even worth it because if I did a surgery that took 2 or 2.5 hours, the actual amount of time it took was like 4. By the time you get the pre-op and the post-op, and I'm like, oh my God, this is crazy. It just is amazing. So, I mean, it was just time to make a change. And that's the beauty of life. I mean, I think a lot of us think that just because we're doing something that we have to be stuck in that role forever. But what I think people are realizing more and more in this modern day is that a lot of those skills are translatable into other aspects of your life. You could literally shift careers 100%, or you can tweak and make a minor turn and, get into something that you really enjoy that lights you up. So for you, I feel like it wasn't a major shift because you're still in the realm of, but you're in your own practice now. So tell us what that transition, because that's only been about 2 years, right?
Yes, 2 years. It's fabulous because like I said, I was always just, rolling into Dr. So-and-so's office. What room is available today for my injections? Okay, this one. I go in there. There's pictures of like robotic proctology surgery on the wall, and it was never my own, and I could never patient experience.
And your aesthetic patients are like, what is that?
Yes, exactly. I know. It's really funny. Of all the disciplines to be combined with. So I love being in my own space and being able to turn on my oil diffuser and the music that I want and the aesthetic that I want and have a really fabulous chair. It's so great to be able to control that experience for me.
Oh yeah. Huge.
Yeah.
And what about, what other things do you like? Do you like the fact that do you plan your days? I mean, do you work regular hours or do you shift your hours?
I couldn't be happier making my own schedule, especially being, at the mercy of a hospital before. Mm-hmm. Oh my God, it's so great. So I hold clinic hours Tuesdays, Wednesdays, and Thursdays. And Tuesdays are when my son's at school, just school hours. Wednesday and Thursday, I always work out in the morning. So I start at 11:30 and I do evening appointments. And then just kind of do whatever I need to do Monday, Friday, work at home or do my own thing.
That is fantastic. Now, how have you been able to find that balance? Because I work with a lot of female entrepreneurs who have somehow not been able to find any kind of balance. Like they work so much and they almost can't stop. Like literally their lives are work, and don't really feel like they have time for self-care or to anything that they do for themselves. So what have you done differently to have that balance in your life?
I make sure to carve it out. I have to have things on my calendar. Like, here's what I'm doing today for myself. If I need to block out 4 hours, I'm a big planner ahead of time. So I'll put things on my schedule, like a spa day once a month. I like to go to the Korean spa and do that like on a Friday. But if I don't do those things, I'm old enough now where I've realized if I don't do the things that I need outside of work, my work suffers. So then nothing's balanced. So I just have to make sure I do everything full circle.
Yeah. I have this conversation with women all the time, because I coach women, and this is the biggest thing that they say. I can't manage to find time for self-care, to take care of myself. And I don't know, I was there too. So I know how it happens because you're so driven.
Mm-hmm.
But do you think that it's because you already had a child before you were an entrepreneur that maybe made that shift different for you?
Probably, because that takes up a lot of my time. But one of my main goals with becoming an entrepreneur was so that I had that free time to do self care. So that was always a goal of doing this.
Oh, because the funny thing was, I remember when I was in my own practice, and I remember thinking, "Oh, I've got control over my life," but in reality, I had none. And I was always at the beck and call of the ER or the hospital or
Yeah,
this or that. And I remember, I'm like, when can I get my grays colored? And I mean, just like I don't have any
yeah,
time to do anything for
right.
myself. And I just remember that was an awful feeling. And it's finally I've gotten it in balance now over the past like 3 or 4 years. But I
Mhm.
wonder if, going into it with that mindset is very different from going into it without the clarity of knowing what you're trying to create. So I
Mhm.
know a lot of women who have gone into entrepreneurship saying that they wanted, obviously, a life that they enjoy living, but in reality, what they've created is something much worse. They've literally bought themselves a job that's worse than the job that they had before, meaning now they work 24/7. They're working nights, they're working weekends, they don't have any time for themselves. They may be physically there for their children, but I think emotionally they are so wiped out and checked out that
Oh
they're
yeah.
not really there. And there's a big difference.
Yes. I don't have the bandwidth for that. I couldn't work 7 days a week, even if I wanted to. It's just not me.
Yeah.
It's not, yeah.
I did it, and it really took a toll on my health and my well-being. And what's interesting is that you can actually do very well for yourself. I think it's a mentality of scarcity. To be honest with you, I've been thinking about this a very long time about what makes the difference between a person who approaches it one way plus versus the person who approaches it the other way. And I think it's a scarcity mentality. There's not enough. There's not enough time. There's not enough money. There's not
Yeah.
enough this. There's not enough that. I've noticed in my life when I've gone through things and really evaluated whether they were right for me or not, and that being the major indicator of what I do, things go very differently. Like it's not just the money, it's not just the this or that. It's like, how well is this person? How well are me and this person aligned? How
Exactly.
well is this how well is this job or this consulting job aligned with who I am and what I like to do? How well are the hours aligned? Do I have the freedom? Do I not have the freedom? Because now I do so many different things.
Yeah.
But I think for me, that's just what I've deduced because I've been thinking about this a long time, how very few of us, I think, get to the place where you and I are. Most of us are stuck elsewhere
Yes.
somehow.
Absolutely.
And it's not an easy journey. I mean, I totally understand that, but because again, you can create. I like to say you can create a monster that sucks your soul.
Hmm.
And I was like, I already did that. I don't want to do that again. I'm not going to create another I mean, I can build these big businesses and make myself
Right.
miserable again. That's easy. I can do it. I did it before. But now
Exactly.
my goal is how do I build something that fits my life in the way that I want it? So I always stop. And I think being mindful is important too, right? Like
Oh yeah.
stopping and thinking like, hey, how do I like what I'm doing right now? Is this working for me? Is this not working for me? Do you do that a lot?
Oh yeah. Well, I'll get into things like I do need like I'll start to think I need to work more, I need to do this, I need to do that. And then I just have to sit back and go, I'm fine just where I am. I'm fine. I need a balance, and that's number one. That's my number one priority is balance. And it's
Hmm.
almost impossible to get there, but I feel like I'm there. And I love my job and everything else that comes with it. So I
Well,
don't question myself that much anymore, but sometimes.
but let's talk about that for a minute because that's important what you just brought up because a lot of women and a lot of people go there, not just women, but I just know because I work with women more, but a lot of people go there like, oh my God, I should do this, I should do that. Let's talk
Yeah.
about those shoulds. Where do those shoulds come from in your mind when they happen to you?
I think as a business owner, I sometimes feel guilt for, if I am not going 100 miles an hour, but I can't. So I think it stems from anxiety and guilt. And I just have to kind of get up and be spiritually wiser than myself and say, I'm okay. I'm fine. This is just where I'm meant to be. And that's okay. I don't need to do anymore. When I do, I will, but I don't need to do certain things.
Right. Yeah. And I think that's a beautiful thing because it's really, really important, because I personally feel like it's societal conditioning. I mean, in this day and age, there are a lot of people who want to work 24/7 or, 15, 16, 18-hour day. I don't know. I don't know how they do it personally. I have no desire to do that.
It affects everything. It affects your health and your longevity.
Right. So I'd really rather be on this planet a lot longer. And that was why I left medicine, because I knew there was a day of reckoning that came, that if I continued doing what I was doing, first of all, I didn't even want to live. So I was like wishing I wasn't around because I was miserable. But then even if I wanted to be around, I felt like I was going to have another health issue with the way that I was feeling. And I think we inherently know when our health is crumbling, even if there hasn't been a diagnosis, so to speak, or you just don't feel good. You don't feel good emotionally. You don't feel good physically. You don't feel good spiritually. And I can definitely tell when I'm out of balance and out of alignment. And then my first goal is, I don't care what happens. Let me get myself in balance, in alignment first. Then the rest usually falls into place.
Right. That's right.
Yeah.
It's a mentality. It's really just a mentality.
I agree. Because I hear stories, and I used to be one of these people, so I'm not picking on anybody or pointing any fingers, but I literally was like, oh my God, have I eaten all day? Have I had a chance to go to the bathroom?
Yes.
Because in medicine, we are trained to ignore our bodies.
You guys are taking call. You're working 100-hour weeks, taking call, taking care of patients, being awake for 48 hours. It's unbelievable.
Yeah. So for me, I had to untrain my body to ignore everything that it was telling me.
Right.
And for me, I noticed it was on so many levels, like just first the physical levels that are affected, because you're just like, oh, I'm hungry, but I can ignore it. I'm thirsty, I can ignore it. I'm sleepy, I can ignore it. So I felt like those were the superficial layers, but then start to go deeper, and there's this emotional unrest within you that really becomes a lot for me to unpack. And I was like, wow, once I figured how all of that was affecting me, I was like, yeah, I can't do that. And it's funny because now my kids really say that I'm a completely different person. I used to have, I had no patience. I was aggravated at everything and everyone.
I felt like that. I felt always tired. Just like I couldn't work out on the days I worked because I was so exhausted, and that's super important to me. It's just hard. It's really hard. It's too selfless. The mentality is too selfless. Or you have to be selfish because you can't take care of others if you don't take care of yourself.
Yeah, which is what leads to burnout, I feel 100%.
Oh, yeah.
Because once you get into, and I've always said, like, the medical system is not really kind to its own people. Here we are. We're supposed to be kind to other people.
Yep.
And how can we be really that kind to other people when we're taught to be destructive to ourselves? It's like the worst situation ever.
Yes, it is. And then people get angry and morale is down, and it's just not good for anyone.
And that's probably why the hospital environment didn't appeal to you or to me.
Yes.
Because we had to succumb to that morale, which was not working for us. I'd rather create my own morale in my own space where I could have a safe haven.
I know. I feel so fortunate that I try to think to myself, what other career in nursing would I be able to be working in a setting, independently in a setting? Obviously, Patrick is my supervising physician, but he's off site. My own site where I'm treating patients, I'm selling skincare. I don't know that there's any other nursing job where you could do something like this. This is it. Yeah.
That's amazing. So when do you think somebody should consider, if they're looking for, maybe considering to go into aesthetics, what are the things that they should know or consider before they make that decision?
They should know that we make it look really easy. Everything makes it look really easy, very posh, very elevated. It is so difficult. It's incredibly difficult to learn. The experience takes years. You have to be up on your clinical education constantly, and start at a med spa and learn everything and get your foot in the door. But
I
just,
think
it's a long road, but it's really, really rewarding.
I think that's great advice because it's so true. Like anybody who does something well makes it look easy.
All the Instagram things just make it look so simple, right?
Yeah. Oh, I heard the craziest story the other day from a nurse that I was speaking with, and she said that she's seen everything, but the story she told me was a construction worker who ordered his own filler and injected them into his own face. And he was septic and got very infected. And I was like, oh my God, now that's a story I've never heard before.
That's a psychological issue.
Wow. Well, I wouldn't even, I don't know. I don't even know how you'd even think to do that.
I wouldn't even inject filler in my own face.
Yeah. So, I mean,
that's all day long, but no way.
Right. So maybe Instagram is making it look too easy. I don't know.
I do believe that. I really do. We're making it look so just easy and so posh. Like everything is just amazing.
Yeah. I could see that. I never really thought about that.
Realistic.
Yeah. And I think that you're right. There needs to be a certain level of respect for the amount of years of training, the knowledge of the anatomy, the complications that can happen, because when the complications can happen, they can be significant. Granted, they are minimal in the, hands of an experienced injector, especially when they're being supervised by a physician, but still things happen. And people should really, when they're going into these procedures, they should know that there's some considerable things that could occur. Everyone should really be well versed on the, when they're reading the consent, they should ask questions. I've seen people in my own practice like barely read the consent, and I would stop them. And if they weren't going to read it, I'd at least go over it with them because they weren't wanting to read it. They were like, oh, it's fine. I've been here before. And I'm like, no. You need to know that these are the things that happen, right?
Right.
So, So what does your son think about what you do? Does he know?
He's so funny. I mean, he'll say stuff about Botox. Like he said something when we were sitting in the car the other day, because he's 11, but he was 10 at the time. We were sitting in the car and he's like, Mom, can you Botox this? He said about me. And I thought, oh my God, I'm going to die. First of all, hearing Botox come out of a kid's mouth is hilarious, but yeah, he has a lot of questions. I mean, he's super interested. It's hilarious. And he'll come in here and I have a little chalkboard that I'll put out front on the street because I have such a great location, and he'll write it out for me, and he'll write all my procedures like fillers, microneedling, like he knows all the things I do.
That's adorable.
It's so cute. Yeah, he's so funny. Mom, do you think I need Botox? That just kills me. And I'm from Northern Michigan. This is like my mom can't even believe I do this stuff. It's hilarious.
Oh, that's so funny. So I wonder what he says at school about what his mom does.
Right? Well, what's so funny is he did a Mother's Day thing last year that's like, what does your mom do? And he just writes Botox. Hilarious.
Oh my God, that's so cute.
That's funny with kids, yeah.
Yeah, that's amazing. That's amazing. So what do you feel like, you weren't practicing aesthetics in Michigan, right?
No.
It's only been in California. But it's funny, different locations have different aesthetic values, I would say, right? So I feel like, when you're in the aesthetics industry, probably Michigan isn't as easy of a place to be because there's probably not as much cosmetic procedures being done there.
Right. Probably outside of Detroit, it's pretty big, but where I'm from, not so much. But what kills me, what's so interesting to me is how different it is from state to state with, the credentialing of people. So like, I think in Texas, you don't even have to be an RN. Anybody can be injecting in Texas, right?
Yeah. There are a couple of states like that. So actually that's a really good point because I wonder if it's like that in Arizona. I actually don't know.
Yes.
Okay.
I think it's Texas and Arizona, and then Florida, you have to be at least an NP.
Mm-hmm.
Yeah.
Yes.
Really
it's very interesting. And that's actually another great point to bring up because, we have viewers from all over the country and internationally as well. So it's very important to know what the laws are because, again, sometimes people don't even know who's injecting. So it's important to ask those questions too. What are your credentials? And, if you're, someone who needs supervision, do you have appropriate supervision? And, how many years of experience do you have? How many years have you been doing this? I think those are really, really important. What kind of complications have you had? Unless you're like a veteran and you've been doing cosmetic procedures with the same person for a while. But if you're kind of new to this, I really suggest that those are very important questions that you should be asking.
Absolutely. Way more important than price. I can't say it enough that price shopping in this industry is not something you want to do. Everybody's prices are pretty comparable, honestly, and cheap can become very expensive.
Oh, I like that. That's a great statement. Yeah. So case in point, I have some people that I know in Arizona, which is why I knew about Arizona. And this woman had reached out to me, a friend of mine, who had said that she had an esthetician who was wanting to inject, I believe it was filler. And I was like, whoa. Are you sure she's an esthetician? She said, oh yeah, I've known her for years. She's an esthetician. And I was like, I don't think that's a great idea. I mean, I don't know what the laws are in Arizona. And later I found out that Arizona does allow that. So it's really worrisome to me. I do not believe that an esthetician has the kind of necessary training and qualifications,
At the very heart of it, it's anatomy. I mean, we learn anatomy in our schooling. We've been anatomical our whole lives. And for someone who is not a medical professional to be injecting this, my mind is blown that that's even legal anywhere.
Right. Well, it's like in any industry, once people start seeing that there's money that can be made, a lot of things go sideways. And that's the other important thing. You can actually tell when somebody's doing it just for the money. I mean, listen, we all need to make money. We got to put food on the table. We got a place to live and all that. So that's a natural part of life. But there's a big difference between somebody who's doing it just for the money. They're like used carsman salesy, I feel like a little bit, Like, oh, you should get this. You should get that's not the environment I want to be in. And then there are people who really, truly enjoy what they do. And honestly, you can tell the difference right when you walk in the door.
Oh, yeah. You can tell an ethical provider versus an unethical provider pretty quick.
Right.
Yeah.
And I've also said to people, when they go to these big places that are super lavish and all that, it's just think about what their overhead is. Think about what they have to do to just break even every month. Now you're wanting to I'm not saying everybody does this. This is not the point of this. I'm just inviting people to consider what happens behind the scenes. Not all places are like this. Some of these places are been around a long time. They're very successful. So but again, I think someplace new that's like that, that's what would worry me.
Yes.
If you just opened and maybe, don't have any, I don't know. There's stuff I always look at that's probably weird because I think too much into everything, but cost is another really great point that you brought up that I really want to go on. Because in many industries now, there's prices start off in one place. And as the industry has more people that enter the industry, then there's a downward competition with price. I was even told, somebody was telling me they saw $2.99 Botox somewhere. I don't remember where. But first of all, that's ridiculous because you can't even buy it for that. So that leads to question, where are they getting it? Yeah. So this is another thing that I tell people if they're new to a practice or a provider to ask, are you buying the branded products?
Absolutely. And what country are you getting them from?
Exactly. These are things people need to know because again, if it's $2.99 for a unit or whatever, you cannot even buy Botox for that price. So how are they making a profit? Right. Are they paying the injectors?
Yes. Which
doesn't make sense. And again, price should not be the only factor in anything that you do.
No.
There are some times where, I guess if you're just trying to save some money, some things maybe it's worthwhile, but there are certain things that, especially when your health is an issue and consequences could be major, like you said, cheap could become really expensive when bad things happen, right? You go to an experienced injector, bad things could happen, but they're very, very unlikely. You go to an inexperienced injector, the possibility of bad things happening, much, much greater.
And then those bad things happen, and then they're coming in my door.
Yes. They used to make me crazy.
Yep. Yep. I just got a ping yesterday on my business line that said, hey, it's a patient of mine. Hey, I was down in Mexico and can I come back to get it fixed? You know, and because of where we live, a lot of people go down to Mexico. I had a patient about 6 months ago who came back with a vascular occlusion.
And for our audience, explain what a vascular occlusion is.
Oh, it's where a little bit of filler gets injected into the vessel and it occludes the blood supply. So the tissues aren't getting blood supply and it can lead to tissue death. Yes. But it can be reversed really easily.
Right.
With an enzyme.
Yes. But you have to, know how to identify the vascular occlusion, which sometimes could be a little tricky, right? So, you have to have an astute medical provider who understands what that looks like, knows how to be, very vigilant about that, and knows the appropriate steps to take. They have to have the stuff in their clinic to be able to inject the enzyme and reverse that problem quickly.
Yes, every filler patient I give my personal cell phone to for emergencies. And then I also explain always what a vascular occlusion or a vascular compression, which is similar to an occlusion, except it's just the product compresses that vessel instead of occluding it, it compresses it. And that's a little bit later onset, but it also can cause tissue death. But I just always show different pictures of what that looks like to people. And they're hyper alert. And some people will reach out with a photo and say, is this what it is? A couple days later. That's okay. No problem. Better to be safe than sorry. But yeah.
Oh, absolutely. And again, I think that says a lot for the kind of, practitioner that you are when you explain to them what they should be looking for. Because again, sometimes the vascular occlusion is not readily obvious while they're in the office, and things can develop later. And if the patient, I've always reached out to me. I'd rather it be nothing. Yeah. You reached out to me and it was nothing, and I tell you it's nothing, than you didn't tell me and something bad happens.
Right.
Much rather one scenario over the other, for sure.
Definitely.
So what are the the rates of these kind of things are very, very unlikely. But, I just want to add that in certain areas, these vascular occlusions can cause blindness and all kinds of other issues. So that's why it's so important to know who you're having inject, know their credentials, know their qualifications, know their experience level, know that they are very vigilant and hypervigilant about emergency protocols, having all the things that they need in their office. And you can actually sometimes even tell those things without, not that you don't want to ask the questions, but I always say that people should look around and see that things are neat and orderly, put together properly. That gives you a little bit of an idea. If you walk in somewhere and if things are disheveled, you just should leave.
Yeah.
Just leave. Run.
Yeah. Right.
But I never thought about that because, obviously I'm a little bit new to California and how close Mexico is. So yeah, I could see a lot of people doing that to get it cheaper, but I don't know how much cheaper it really is, but I guess it's much cheaper.
It is, and there's like a shuttle. Sometimes there's a shuttle that will drive people down, but it's just not being near your provider after a procedure. It just doesn't make sense. It's a procedure, it's not, unless it's Botox. Whatever, but Botox a little bit easier, but still not being near your provider after a procedure is just not safe.
Yeah, well, 100%. Now, I know Mother's Day is coming up, so I didn't know if you had any specials or anything you want our audience to know, for anybody who's in Encinitas and local.
Exactly.
Or heck, if they want to fly out to see you, why not,
Come on out. We welcome everybody.
Yeah, it's a little trip to San Diego. Why not? Yeah. It's beautiful here.
Exactly. I like springtime kind of for the skincare stuff. I love microneedling a whole bunch. Microneedling is amazing. It's a home run for every skin condition. It's going to regenerate collagen, minimize brown spots, fine lines, acne scars, pore size. It just is one of the staples of anti-aging. So this month for Mother's Day, I'm including a Zeo skincare anti-aging program to pre-prep your skin. And also it's your aftercare. So it's going to give you the best results afterwards. So that's included with the series of 3 microneedling treatments. And yeah, I think I'm just going to do that. I haven't really thought about much else.
Put you on the spot. Put you on the spot. But actually, I do want to talk about, so the other things that you do we cover all of the procedures that you provide? We talked about microneedling, we talked
Yeah.
about filler, we talked about Botox, but
Yes.
actually let's talk a little bit about places that people can get either tox or filler
Oh
that
yeah.
people
Sure.
might not readily know. You know,
Oh
there's
yeah. Botox is not just for our upper face. There's a lot of low face treatments too. So we can turn the smile upside down. Botox does the opposite of anything we do. And when I say Botox, I mean Dysport, Xeomin. That's like the Kleenex of our industry. So I'm referring to every neurotoxin. But you know, if you frown like this and we put a little Botox in there, it's going to turn it up, and also the chin too. So it does the opposite. Down there, we can get these, which pull down our face. So if we hit these muscles down here in our neck, as well as right here, it can actually give you a little bit of a lift. It helps for stroke patients also, and people with Bell's palsy to even things up. What else?
Oh, Master, do you do TMJ
Oh yeah,
injections too?
yep. Masseter, the TMJ over here. That's a great one for people that have pain or clenching or just want a slimmer profile. Depends on if you're a candidate for that slimmer profile, but there's so many uses. It's amazing. We can lift the brow a little bit.
Yeah. And it's funny because most people don't know all the other areas
Yeah.
Botox can be used or any of the toxins can be used.
It's a great medication. Gummy Smile is great. We just put a little bit in the muscle here. And you can always tell if you're going to look weird. So we always test like, okay, you have a gummy smile. If I were to put a little tox in my LL Sands, I would look weird. That's what I look like. But if someone with a gummy smile gets it, then it just lowers it.
Yeah.
So instead of being up here, it's just here.
Yeah, that's actually a really great one because I know gummy smiles really bother people. And I love the brow lift that you can do. You can always elevate the brows a little bit. And, you know, obviously the 11s, people already know, you know, in between your eyebrows, a lot of people know about that. Crow's feet. Those are the common ones, but I like talking about the
funny
less
lines
common ones.
that'll slim the nose and also help. Sometimes people have lines right here because of the pull from the bunnies. So if we get these muscles right here, it can help this too. And, you know, people sometimes just treat it just for the bunny lines, but that's good too.
I think it's important to obviously have a consultation, but it's just nice to know what all is available. Just so you know, you can get a real comprehensive kind of makeover, really, you know, depending on what you're looking for. And then with filler, you know, if you can kind of talk about like the areas that can be addressed with filler, we talked about temples before, but what are the other areas that people may not readily know what are the other things we can accomplish with filler that people may not readily know about?
Okay. So not only do we have hyaluronic acid fillers, which people are used to, like Juvederm and Galderma syringes like that, but we have biostimulators now, which is Radiesse and Sculptra, and those can go pan-facial all over the face, and it's going to regrow collagen, lost collagen, and it's gradual. So I liken biostimulators to the cake of the face, and hyaluronic acid fillers are like the frosting. Those are going to contour and lift a little bit. So those are more for contouring. But the combination, everything in this industry is multimodal. We don't age in one area, so we have to treat the whole face, and that's multimodal with biostimulators, patient-specific, but biostimulators, hyaluronic acid fillers, neurotoxin, microneedling, medical-grade skincare. That's the anti-aging regime that's like...
I love it. I love that. Well, yeah. And microneedling too. Actually, I want to talk a little bit more about that because you mentioned microneedling, but a lot of people may not know what that really means. So if you could just expand a little on the microneedling and then the topicals that you use with the procedure.
So microneedling is just creating controlled micro injuries with many little needles in a little pen that glides across your face when you're totally numb. And those micro injuries cause inflammation, and that's going to regenerate collagen and elastin. It's going to tighten your skin, thicken your skin, and it's also going to break up the melanocytes. It's going to help with pigmentation. It's going to help with scarring, acne, everything. Anything that's wrong, it's going to help. But I like to add PRF in there, which is platelet-rich fibrin, your own blood. I spin it in a centrifuge. Fibrin comes to the top, rich in growth factors. Growth factors help accelerate communication between dormant cells and whatever we're trying to get to. So it's going to wake up your own body's regeneration of collagen and elastin. I also like exosomes. Exosomes are extracellular vesicles derived from adipose tissue, are the ones I use. That's going to
Which is fat. For those of people who don't know, fat tissue.
Yes. And it's going to increase your recovery time amazingly. Exosomes are awesome. We can also put those in the hair to regenerate hair.
Yeah, yeah. And do you do for hair too? You do?
Yes.
So, yeah. So, I mean, there's a lot. I mean, your hair can also make you look like you're older too when you start to have, receding and
cul-de-sacs. Anywhere that there's a little bit of hair growth, it can regenerate it.
I know. See, that's amazing. So again, this is not the one-stop shop from this show to find out what one needs, of course, but I'm glad that everybody hopefully got a nice little overview, at least to understand what can be done. So, any other things that people need to know about how to find you? I have your website displayed down there. And then what about your social media handles and all that?
My social media, I'm on Instagram and I'm at artistic.rn.
Perfect. Well, I have to say, this was such an insightful conversation. It was enjoyable. We got to talk about aesthetics. We got to talk about entrepreneurship. We know that your son knows more about Botox than he should, and that's all good. But, as long as he's not out there giving people consultations, we're good. Which I think is adorable. But it was a pleasure to have you on today. And, we will definitely, I'll see you soon, I know, because I'm going to come in and get some microneedling now.
Yes, smart woman. Microneedling go down the neck and chest too. Just wanted to mention that. There's neck and chest regeneration too.
Yeah, no, that's important because you don't want a face that looks like 15 years younger than your neck. And and then there's also hands and stuff. There's really a lot. We could just open up all the things, but just so people know what can be done. Yes. But anyway, you have a wonderful rest of your evening, and I'm sure I'll see you soon.
So much.
Bye.
Bye.
Well, everybody, thanks so much for joining us on another episode of Gloves Off. I hope that today's episode was really insightful to you because you know what? We are living longer than we used to. So it's not weird anymore to want to look as good as you can for your age. One thing that I didn't mention during our talk with Anna was that sometimes for people, it's not about looking younger or being vain. It's about looking as good as they feel on the inside. So, I think I fall into that category. I mean, inside, I feel like I'm in my mid 30s or early 40s, which is not my true age. But, I want to look as good as I feel. So a little bit of maintenance goes a long way. So thanks so much for joining us. Next week, we are going to be interviewing Dr. Sean Hubbard. Now, interestingly enough, he and I went to medical school together in Florida. So we've known each other, gosh, I want to say it's been 30 something years. I have to do the math and think of when we graduated. But, we've managed to stay in touch, and I think it's going to be an amazing interview. He and I have a little bit of a different path in medicine. We have other interests outside of medicine, and I think that's what's kind of kept us being friends for so long, and it'll be an amazing interview. But you guys have a fantastic rest of your evening. Again, like us and give us comments on my YouTube channel at Gloves Off TV, and we will see you again next week, same time, 6 p.m. Pacific Standard Time on Gloves Off.